Hello, everyone, and welcome to episode 3, the finale of a mini-series on heart failure by us, the medical podcast. Today, we will be talking about the 3 preventative measures for congestive heart failure.
The first prevention for heart failure, and one of the preventions most people can do, is maintaining a healthy weight that is under the BMI of 25. Maintaining a healthy weight means that the heart has to strain itself less when pumping blood, and therefore there is less chance of muscle failure in the left ventricle, and that is the segment that causes heart failure. People that are overweight, their hearts have to work much harder than people who maintain a normal weight, and therefore overweight people have a much higher chance of developing heart failure.
The second prevention method for heart failure, and another one that is pretty simple, is not using recreational drugs and consuming alcohol. If you use recreational drugs, the chance of a higher blood pressure, which massively increases heart failure, skyrockets. Without drugs, blood pressure will stay at a relatively normal blood pressure and therefore not strain the heart muscles as much, reducing the chance of congestive heart failure. Furthermore, if you consume alcohol on a regular basis, your heart will experience cardiomyopathy, which causes heart muscles that pump blood to dangerously stretch and enlarge, skyrocketing the chances of heart failure in people that do not have an already high chance of experiencing it.
Finally, our third recommended prevention measure for heart failure is to take care of conditions that could lead to heart failure, such as heart attacks or coronary heart disease. If somebody suffers from a heart attack, it is imperative that they deal with what is causing it and go to the doctor, as when a heart attack hits, it has a high chance of greatly weakening the muscles in your heart, which pump blood, which leads to congestive heart failure. Furthermore, if you suffer from coronary heart disease, a disease in which your arteries are blocked by a buildup of fatty substances, your heart muscles will weaken gradually and then lead to heart failure as the heart muscles fail to pump the correct amount of blood. If you treat these conditions, however, risk of congestive heart failure falls dramatically.
And with that, the 3-part mini-series on congestive heart failure comes to an end. This is the Medical Podcast signing out. We hope you learned something about this disease in any of our episodes and that it might save your life one day.